For family members, there seems to be a lot of fear and sometimes confusion about what they're seeing in their loved one and wondering, will treatment be helpful? Do they need treatment? Sometimes what we'll do is an assessment either over the phone, or we'll have even the patient come in for what we call a RAP assessment. And then we can help the families and gather collateral information. They oftentimes have a lot of information that would be helpful in deciding, is this chemical dependency? Is this just something that they started to do because they had chronic pain? With family members, what we ask them is, what is their living situation like? What we'll have them realize is that oftentimes the patients are no longer functioning at the level that they had been, and we'll get background information about what are the major changes or stressors that have gone on in that loved one's life. This population of seniors demands respect, and therefore we use a non-confrontational style of therapy. Due to their medical complications of other types of conditions, we have them in a slower pace, usually at first, and then meet them where they are and have them join in as they are able to do so. With late onset, which is what we also see with this population, they had been functioning for a very long time until they might have had a retirement or a loss, and then all of a sudden they see a decline in their functioning. Grief is a huge issue with treating the seniors because it's complicated. It's not just about the loss of a loved one. Oftentimes it's the loss of their jobs, retirement. That seems to be what they identified themselves. That's who they had become. And it's also around the loss of time and tremendous amount of regret of, why didn't I do this sooner? Look at all the problems I've caused my family. And there's a lot of sadness around that. The therapeutic approach that we use on the seniors unit is a combination of cognitive behavioral therapy as well as dialectical behavioral therapy, which is about using your wise mind, and also mindfulness practice. We find that having the same age groups helps them with their socialization and interacting with their peers, getting to know them and getting to talk about their own histories is very beneficial to them. We are allowing them to enter at their own pace and, of course, giving them encouragement. And I think one of the biggest parts as well is the medical staff, who are extremely careful with assessment and an ongoing care for this population, seeing them on a daily basis, adjusting medications as need be, monitoring their well-being. We have a fall risk assessment, and it's just extremely thoroughly done. I believe it doesn't matter what age you are, it's never too late, first of all, to develop an addiction. It's never too late to intervene on one, and it's certainly never too late to get sober.